Vaccine hesitancy is becoming a growing concern for the South African government as the country tries to make its way back to pre-COVID times. For South Africans to return to life as we knew it before the pandemic hit our shores in March last year, we will need to reach herd immunity. But so far, only 17% of the South African population has been vaccinated. I'm Catherine Rice, journalist for News 24's Multimedia Department, and this is The Story. This week, we'll delve into the worrying trend of vaccine hesitancy, what it means for our future, and what can be done about it.
You're listening to The Story. It's a podcast by News 24. We'll speak to journalists and experts about the week's biggest story. This is what we saw, heard, and uncovered this week.
We're talking to head of the Biomedical Sciences Department at the Cape Peninsula University of Technology, Professor Glenda Davison. Professor, some people seem to have a wait-and-see attitude when it comes to getting vaccinated. What is that about? Is it the misinformation that is out there? And how widespread do you think it is?
Good morning, Catherine, and thank you for inviting me to this interview. Yes, it seems that you are correct. Many surveys have been done, and it seems that over 70% of people are very willing to have the vaccine. But when you look at how many actually are registering and going for the vaccine, this drops significantly. So there is obviously a perception out there of wait and see. Let's see how safe this vaccine is. Of course, there are some people, around 5%, who are anti-vaxxers and who are not going to get the vaccine. But I think the issue of those people who want to have the vaccine but are a bit fearful of it, I think they fear it because they feel that it was developed too quickly, that perhaps not enough trials were done on safety, and there are some people that genuinely fear having a vaccine or having a needle. So what to do about this, I think, is more education and to assure those people that all these vaccines that have been approved by our regulator and the FDA have gone through extensive clinical trials.
How exactly does the vaccine work? Some people are getting infected with COVID-19 once vaccinated, so it doesn't make you immune. But just what are the benefits?
Okay, so the vaccine isn't going to eliminate the COVID-19 virus. The virus is still there. We have to know what it means to be fully vaccinated. So if you got the J&J vaccine, that means one dose, and then at least 2 weeks after that to allow your body to mount and build up the antibodies to fight the virus. And for the Pfizer vaccine, that means 2 doses, which are about 6 weeks apart, and again a 2-week period to allow the body to build up the antibodies. So what does happen is if you've had the vaccine today and in the next few days you come into contact with somebody with the virus, it means that you can still contract it. And we're seeing that a lot, and I think people are thinking that that is because the vaccine isn't working. But the benefits of the vaccine are huge in that although there are breakthrough infections, as we've discussed, and even after the 2 weeks, the main benefit is that it prevents severe disease and death. And I think this has been very clearly demonstrated around the world, such as in the UK, where they've vaccinated a large percentage of their population. Even though there were a lot of infections with the Delta variant, there were hardly any deaths and hospitalizations.
What needs to happen for our country to return to normal? How many people need to be vaccinated before we can reach herd immunity?
Okay, so originally, in the first wave, the Alpha variant, it was calculated that around 67% of the population needs to be vaccinated to reach what they call herd immunity. However, that is a moving target because as we have seen, we've had the development of new variants. We've had the beta variant, and now we have this very contagious Delta variant. And so that, if you call it, endpoint has kind of shifted now to 80-90%. And in fact, reading about it, they are actually not sure. And my opinion is that until the world becomes vaccinated and everybody has access to the vaccine, we probably won't get rid of this virus, because if there are people to infect, the virus will attack and infect and continue to replicate.
What about severe reactions to the vaccine? Is there a big risk of that?
There is a very low risk. It's very rare that people will die from the vaccine. But like all medications and vaccines, there is a small percentage of people that develop side effects. And this vaccine, both of them that we are using and others, are no different. But it has been less than 1%, even lower, of people who've developed severe infections. So again, I'd just like to emphasize your chances of getting severely ill and dying by getting COVID itself is far greater than if you take the vaccine.
And Glenda, what about immunocompromised people? Should they be getting the vaccine?
Here again, I'd say definitely yes, because immunocompromised people have a compromised immune system. So if they get infected, they can't develop as good an immune response as somebody who has an uncompromised immune system. So the vaccine is certainly going to assist them in mounting that immune response to prevent that severe disease and hospitalization. And in fact, in preparation for this, Catherine, I was doing a bit of reading, and in America and in England now, they are looking at giving boosters, particularly to immunocompromised people, because they found that it is this group that, because of their immunocompromisation, they can't mount that big immune response, and in fact are thinking of giving them a booster so that they can mount that immune response to prevent infection. So the simple answer is yes.
What do you think the government should be doing to encourage people to vaccinate? Should we be having a lot more educational campaigns?
Yes, very definitely. And I think credible education campaigns that is in all languages. I think some people in rural areas and who don't speak English are probably not getting the correct information or information that they trust. So they would rather listen to a friend or a person in the community. And I'm not saying that they don't know, but I think that the government should drive a really good education campaign in all our official languages and in areas where people don't perhaps have access to television and the internet. I think the other side is removing barriers to vaccination. I think a lot of people aren't registering because perhaps they don't know how, or they don't have a cell phone. So perhaps there needs to be more of a drive to actually go into communities and go door to door and help people to register. The other thing is to make those vaccine sites in communities so that people don't have to travel to, for example, the CTICC in Cape Town to get their vaccine. They can just walk down the road. Now, I know that is happening a lot, and I'm very optimistic that that's going to increase. And I think we have made huge progress with the vaccine drive, but I think a lot more can be done.
Thank you so much for your time. That was Professor Glenda Davison, Head of the Biometric Sciences Department at the Cape Peninsula University of Technology. We're now joined by News 24 journalist Tebogo Monama. Tebogo, the vaccination campaign started in February, but it isn't really going fast enough. Which age groups are hesitant, and what is behind this?
So vaccinations opened in February for healthcare workers, and then it opened up for people aged 60 and above. And so far, it's open for people aged 35 and above. And in September, it's going to open up for 18-year-olds so that will be all of the adult population in the country. And in terms of hesitancy, we are seeing vaccination sites being empty and things like that. But I think it's also a bit too early to say which groups are hesitant, right? Because I don't think we have the stats now to say that people in the 35-year age group are not going, or people in which age group are not going. I think the research around that is still being done. But what we are seeing is that the Department of Health has said that they are seeing a problem with men not showing up to vaccination sites. So now they're trying to build campaigns around trying to encourage men to come forward to vaccination sites.
And Teboho, what are some of the myths on social media that have been circulating?
They really vary from the really absurd ones, like, oh, then they're going to, if you get the vaccine, you're going to be tracked. There is a magnetic tracker in the vaccine. So there's a variety of ones. So they move, there's also like the religious ones, where people are like, oh no, this was said in the Bible, in Revelations and things like that this is the sign of the beast, so you mustn't get vaccinated. So it's just a variety of reasons. But I mean, the most interesting thing is that even when you counter those myths with scientific reporting, with all of those things, they still refuse to move from their position. They are just not budging. It's really bad.
And in your reporting on this topic, have you been able to get a sense of how doctors are experiencing our third wave in terms of treating patients who haven't been vaccinated?
I mean, the third wave has been the most brutal wave we've had so far. We did a story last week speaking to a virologist from Wits University, Dr. Claire Cutland. And I mean, even though she doesn't work in hospitals, she has colleagues who work in hospitals, and she's saying they are starting to see patients who say, I wish I had gotten vaccinated. I wish that I had gotten the vaccine. I mean, and sometimes it's not because people did not want to get vaccinated. It's because we did not have enough vaccines, or it wasn't open to the age groups and things like that. That's why they're showing this remorse. But I think the message is that as the weeks go by, we're going to see more people in ICUs showing regret that they didn't get vaccinated when they had the chance to do so.
Do you think that vaccines should be mandatory in South Africa, and also whether employers should be able to force employees to be vaccinated?
Look, I think that's going to be a very tricky one. I think that's one thing that companies and employers are going to have to... We're going to see them going to court over this issue in the next couple of weeks, in the next couple of months. Because the issue is this: in the Constitution, everyone has rights, right? You have the right to religious freedom and bodily integrity. So you can say that I don't want to get medical attention or medical help or the vaccine because it's against my religious rights, and I want to maintain my bodily integrity. But I also, as your colleague, have a right to freedom of life, right? And if you are going to then be spreading COVID-19, putting my life in danger, if I have comorbidities and things like that, it's going to be very hard. And so the Department of Labor released recommendations around vaccination in the workplace. And they're saying that if someone doesn't want to get vaccinated, right, you must take them for counseling, explain why it's important to get vaccinated. And then if they still do not want to do that, you must try and accommodate them in the workplace. So some of the accommodations would mean the person must work from home. If they can't work from home, they must work in their own office, they must have their own workspace, wear masks during office hours and things like that. You know, sometimes it might be a stretch for employers to be able to do this, so we might see people getting fired or getting retrenched because because they're refusing to get vaccinated. The labor lawyers that we spoke to last week said we are likely to see all of these cases going to court very soon. And the South African Human Rights Commission has also said that they have received complaints from people who are saying that their employers are forcing them to vaccinate. So I think the courts are likely to be the last people to decide whether it should be mandatory or not.
But I mean, Teboho, the big question is, how do you prove that you've been vaccinated? In other countries, they have introduced an app with a QR code that proves you have been vaccinated. And right now, we have nothing like that. Shouldn't the government be doing more to introduce a foolproof vaccination certificate?
I mean, I think that is a great idea, but I don't think that it should be what we are focusing on right now. What we should be focusing on more now is saying we have enough vaccines to last us the whole year. People should come out to vaccination sites. And the other thing is, as much as we might want an online system and all of those things, I think those will be introduced later on when the take-up for the vaccination grows. But I mean, a vaccination card like that we have now, I think it works okay, because we have, like for instance, when we travel, we have those yellow fever vaccination cards. Those are big and those are cumbersome and all of those things, but I mean, they still work, So I think just moving it digital is just a nice extra.
Yeah, the main thing is going to be actually getting the population vaccinated across the board. Thank you so much for your time. Thank you. That was Teboho Monama, journalist for News 24. That's it from us this week. I'm Catherine Rice, and this week's episode was produced with the help of Amy Gibbings.